Hi everyone, my name is Anis. My groupmates and I are going to present about medical informatics with a focus on electronic health records, or we call it EHR. Next slide. So here is our lesson outline. We'll be going through
Oh my god,
introduction, importance, key features,
which is annoying.
EHR implementation, benefits, also future of EHR. Next slide. So, what is medical informatics? Medical informatics is basically the use of computers, also
Oh
technology,
fuck, I'm
to
gonna die.
manage health information, and it also helps doctors and hospitals to give better care to patients. Next slide. And one of the most important tools is EHR, which is electronic health records. It's a digital version of a patient's medical record, like their history, lab results, medication,
Motherfucker.
allergy, as well as doctor notes. So the best part is that the doctors, they can access this information anytime they want, even during emergencies, which helps in faster and safer treatment.
Ah shit, thank
And
you Lord.
now I'll pass it
Yep,
on
thank
to
you.
my next
Thank you.
teammates to be talking
That's it.
about
I'm gonna get
importance of EHR.
shit.
Okay, so I'm Najiha and I'll be presenting on the
Punta
importance
pa ka,
of
Penny.
EHR.
Tanga, namatay
So
ka.
the importance of
Bakit?
EHR is
Malapit?
that it increases
Yeah.
efficiency and reduces paperwork, which
AFK
means
dude.
that
I gotta go.
it reduces the physical
I have
paperwork,
to
it makes the office work
get
more easier and more accessible. And this allows the healthcare workers to access, update, and share information much faster and saves time, saves paperwork as well and as resources and reduces delays in treatment. It also improves quality and continuity of patient care, which means that EHRs they provide complete and up-to-date patients care information to all authorized healthcare professionals, and they also speed up the diagnosis and treatment, so there's better decision making, and especially when the patient is in multiple providers or being transferred from one hospital to another. The third is patient safety. So patient safety with the help of EHRs is that it reduces medication errors by providing alerts for allergies, drug interaction, and also duplication of prescription. And these reminders that are automated, they help get the important tests or follow-ups that are not missed, so that healthcare workers know when to provide these patient safety. And the last one is data accessibility and sharing. So for data accessibility and sharing, authorized users can retrieve and get more updates on um, recent patient information from different locations, making it easier to read information during emergencies or referrals. Okay, now passing on to the next presenter.
Hi, I am Raja Iqbal, and I'll be presenting on the key features of EHR system. First one is comprehensive patient information, where it stores demographic, medical history, allergies, medications, and clinical notes. It also centralizes patient data for easy access and continuity of care. Next is clinical documentation. It enables structured documentation using templates or free text, includes clinical decision support system to provide alerts, reminders, and evidence-based guidance. Basically, it is a template for documentation and real-time alerts for better decision. Next. Next is computerized provider order entry and e-prescribing, which is it allows electronic ordering of medications, tests, and referrals. It also reduces errors and improve efficiency. Fourth is test results and imaging interpretation. It automatically imports lab and radiology results into patient's record, and it also helps providers track progress and make informed clinical decision. Next. Fifth is patient engagement tools. Basically, the patient can view records, book appointments, and message providers. And lastly is interoperability, security, and billing, where it ensures secure data exchange across systems and facilities. And it also includes encryption, user authentication, billing, coding integration for streamlined operations. That's all for me.
Okay, now we're going to talk
Next.
about EHR implementation. First is we need planning and assessment. Identify the hospitals and specific goals like so that it will improve the workflow and better data access. Engage stakeholders like clinicians, IT staff, and administrators, and also access current IT infrastructures and workflow. And then for the next step is selecting the right EHR system. Choose a vendor that complies with standards such as HL7 and HIPAA. Next, we have consider customization, support, cost, scalability, and interoperability. And the next step is infrastructure preparation, where you can upgrade the hardware and network capabilities. This to ensure data storage solution secure and compliant with regulations. Okay, next. We have data migration. The data transfers existing patients' record from paper or legacy system to the new EHR system. This ensures data accuracy, integrity, and completeness. And the next step, we have staff training, which this provide role-based training to all healthcare professional. This uses super user or champions for peer support and troubleshooting. And next, we have system testing and go live. This is to conduct pilot tests and simulations. The go live in phases, there are examples like department wise to manage change effectively. Okay, next. And lastly, we have post implementation support, which offers technical and user support and also monitor the performance and make uh, iterative improvements. Okay, that's all from me.
Alright, so now I'll be explaining some of the benefits of electronic health records. So first, it gives doctors and nurses easy access to patient information so they can quickly see the full history without going through paper files, which will take consideration amount of time. Second, it helped to improve communication. So all departments like the clinic, lab, and pharmacy, they can see the same updated record, which helps to avoid mistakes. Okay, next slide. So the third one is that EHR will help to reduce medical errors. So it gives alerts if there's any kind of drug allergy, wrong dose, or repeated tests. So it will help to keep patients safer. So fourth is it saves time as well as cost. There's no need to write by hand or do extra paperwork. So healthcare workers can focus more on patient care. And lastly, EHR helps with long-term care, so they can track changes in the patient's condition, which is very useful for chronic diseases like diabetes as well as heart problems. So now I'll be passing on to the next presenter.
Hi, I'm Amira. I'll be talking about the future of EHRs. So first, let's look at mobile access and voice recognition. So doctors can now use phones or tablets during patient rounds. This makes it easier to record notes quickly and then can even speak instead of typing. Next one is EHRs are becoming better at sharing data between hospitals and clinics. This helps reduce medical errors caused by missing information, and it also allows patients to move between providers more smoothly. Next is EHRs are now designed to match how doctors and nurses actually work. This helps them make faster and safer decisions. AI can also support diagnosis by offering helpful suggestions. And last one is automation of front and back office tasks. So things like filing, coding, and administration can now be done automatically. Hence, it saves time and reduce workload. Next slide, please. So, in conclusion, EHRs are very important for healthcare professionals, especially for cardiovascular technology. So, there are 3 points and why it matters for CVTs. So, first of all, they improve workflow and accuracy. With real-time tools and AI support, CVTs can interpret ECGs, monitor rhythms, and report abnormalities faster and more accurately. Second, EHRs enhance collaboration between healthcare professionals. By having access to patient histories, lab results, etc., all in one system, it becomes easier to work as a team and provide better cardiac care. Lastly, EHRs support preventive and long-term care. CBTs can use data from smartwatches or lifestyle tracking apps to spot early signs of cardiovascular risks and help patients stay on track with their heart health. In short, EHRs help CVTs provide safer, smarter, and more connected care to heart patients. Thank you.